welcome back to the show. Harlem United is a not-for-profit organization that's working to address the issues and concerns of underserved communities in New York. Now, for over 30 years, their mission is to provide healthcare, housing, prevention, and supportive services to those most in need, also fighting for the community's right to access these services equitably without barriers of racism, stigma, or discrimination. Sharing now more details about Harlem United is the Chief External Affairs and Development Officer and the Executive Director of Upper Room AIDS Ministry at Harlem United, Tamisha McPherson. And Tamisha, glad to have you here with us on Open.
Thank you so much for the invitation.
Glad to have you, and I'm glad to have you sharing. Harlem is home, and glad to introduce people to many more of the programs and services going on. So, for those people who don't know about Harlem United, please give us a little bit about it.
Sure. So Harlem United was found in a basement at the height of the HIV and AIDS epidemic, and this was back in 1988. Harlem United provides critical care to the underserved communities struggling with multiple chronic conditions such as HIV, serious mental illness, and substance use disorders. Back in 2000, we started providing primary care to our client population. And since then, Harlem United has expanded to offer an ever-growing array of integrated co-located services, including primary care, specialty care, cardiology, podiatry, gynecology, behavioral health services, and
yeah. And so you guys do a lot in the area of health and supportive services. Talk to us a little bit about where we are today. I mean, we're in the middle of this COVID-19 pandemic, and you guys have been navigating and still being able to provide health and supportive services. What are some of the services that really have seen a great hit during this time?
Sure. So for our supportive services, I have to tell you our adult day program, which is a program that definitely works with our HIV population. We did not close through the entire pandemic. Our food and nutrition program, our health home care management program, and primary care, behavioral health, dental, cardiology. There was a limited amount of dental services offered during the pandemic. Housing, we continued to offer, I want to say most and all of our services were accessible throughout the entire pandemic. We did see an increase in mental health services, which we were glad that we were able to meet clients where they were in the middle of a pandemic where people were going through so much.
Yeah. Being those essential workers, how hard was it for you really being able to stay open and navigate during this pandemic, knowing that there was such a great need amongst the community?
So for us, I mean, within days, we definitely transitioned to telehealth, which was new for us as a small agency. Our healthcare team did a fabulous job of that transition. So we went from seeing maybe 150 to 200 clients a day on site. That decreased to about 50 to 60, and the rest of those visits were through telehealth. So we wanted to make sure that all of our staff were equipped with laptops and phones and able to meet clients where they were. There were some challenges with some of our clients at the time that did not have the platform to interact via telehealth. So those clients were able to come into our clinics.
Yeah, which brings me to a similar topic. Talk about health equity and access, because for many in the underserved communities, having health equity not really doesn't really happen all the time. And you spend a lot of time working in your organization trying to make sure that there is health equity as well as access to those resources. Share with us a little bit about how you're on the forefront here.
Sure. So we meet clients where they are. If clients walk through our doors, they have no insurance, they are underinsured, they in between switching jobs, we can't turn clients away for the inability to pay. So we meet clients where they are from a harm reduction model. So if the client is in a place where maybe they didn't feel comfortable going to another health center, maybe they went to another health center and they fell out of care, we meet them where they are. So we have patient navigators, we have case managers, and the clinical team across the agency, we have over 45 social workers. So we're able to connect clients to social workers that can assist them with their social needs as well as healthcare.
And you started talking about how Harlem United was formed basically during the HIV and AIDS epidemic when it first really took off. And I know that you continue in those services. How's it going in the area of prevention and awareness, given the fact that we are doing better? We've got more medicine out there. There is more testing and things available. How are things working in that area?
So prevention and testing has, I have to tell you, increased over and during the pandemic. So some of our programs under the prevention umbrella, they were out in the field testing clients, connecting them to care. The clinics were doing testing. We are actually happy to see more funding coming out for testing because we want to make sure people are aware so we can help them and meet them where they are. So our team was on the ground during the pandemic, and then we have another umbrella under prevention umbrella, which is our harm reduction, which is our syringe exchange program, where we saw a need, and they worked through the entire pandemic as well. So we're an agency where we are on the ground during and before the pandemic, and we were on the ground throughout the entire pandemic and really meeting clients where they are. And keeping them engaged and care for us is very important because it helps them stay out of the emergency rooms and actually drive up the cost of healthcare. So agencies like us, we connect with clients on the ground in the community. And some clients that have never been engaged in care, we introduce them to healthcare where they don't have to worry about how it's going to be paid for.
Yeah. So I know another part of what you do is dealing with the undetectable viral suppression program. And for someone who may not be so familiar, give us a little bit more insight in there.
Sure. So our undetectable program is a very popular program. It was about 6 programs in New York that were funded, and we were one of them. And that program basically works if the patient remains undetectable, they are offered actually eligible for a $100 gift card. And in order to do that, it's not easy for the patient, but it does work for the patient of one, reminding them to stay engaged in their care, staying on their meds, and then having a team of case managers working with them on a regular basis to help meet their needs. So that program, we've been funded, I want to say over the last 6 years, we've been refunded to actually keep that community and the patients engaged. And right now we have over 140 patients that are in that program under our umbrella. I think there's about 1,000 across the state. So they're high-risk patients. We're able to really keep them engaged and keep them undetectable. So it's a great program, and we are glad to be one of the recipients to receive that grant.
Yeah, I know you do great work, but also with great work comes great challenges. And I know COVID-19 has really heightened challenges, particularly for those who've been essential workers. What are some of the things you've been having to wrestle with and deal with during this time?
So I think one of the biggest challenges for us has been staffing. So we have a great team. There's been a nursing shortage in the state on a national level as well, and provider shortages. So with that, we have definitely been meeting clients where they are, but we have had people leave in regards to moving out of state and for great reasons for someone's life, but it does put somewhat of a gap in care in regards to us transitioning and actually meeting clients where they are. And when I say gap in care, not necessarily with the client, but gap in the time frame of finding someone else because there is a need. The other challenges I would say that we have faced would be early in the pandemic was supplies like everyone else. So in regards to masks and other items, at times we were waiting on things, and that was in the height of the pandemic. Everything is fine now. Overall, I think we worked and met the challenges where they were, and we worked great as a team and agency to really get through the entire, I want to say we're still in the pandemic, but get through the bulk of what happened between March and I would say even July, where people were working from home and we were working around the clock and working with staff that were on site to make sure of meeting the client's needs.
Yeah. Well, Tamisha McPherson, thank you so much for being our guest here on Open. Doing great work, even in the midst of struggle, essential workers, and we're glad for the services that you're providing for the residents of Harlem. Thanks so much for being with us.
Thank you.
Tamisha McPherson from Harlem United. Now, if you want more information, don't hesitate to visit their website, harlemunited.org, or also on their social media platforms, Twitter and Facebook, at Harlem United. We encourage you, don't go anywhere. We've got more show coming up. Open continues coming up right after this.